Welcome to Infection Navigator. Today, April 28, 2025, we embark on a meticulous journey through the current landscape of viral diseases unfolding across the globe. In a world increasingly interconnected by trade, travel, and technology, viruses, unseen yet profoundly impactful, continue to weave themselves into the narrative of our time. The resurgence of measles in the United States and Australia stands as one of the most unsettling developments. After decades of control efforts, nearly eradicated through aggressive vaccination campaigns, measles is clawing its way back, primarily fueled by a disturbing trend of vaccine hesitancy. In the United States, close to 900 cases have been reported across 30 states. Texas remains the focal point, where 646 cases have been documented since January. Tragically, 3 deaths have been confirmed, 2 among schoolchildren and 1 adult, all of whom were unvaccinated. The Centers for Disease Control and Prevention emphasize that 97% of those infected lacked immunization, a sobering reminder of how quickly preventable diseases can reclaim ground when public health measures falter. In Australia, the state of Victoria has witnessed a comparable surge, surpassing its total for 2024 within just 4 months of this year. Exposure sites like Melbourne International Airport and major retail hubs have been identified, creating a patchwork of potential transmission points. In response, public health officials have urged immediate vaccination for those yet unprotected. Comparing today's numbers with the measles resurgences of the early 2010s, one finds uncomfortable parallels, a pattern where disinformation spreads faster than the virus itself, eroding decades of hard-earned immunity. Experts warn that unless vaccination rates return to the critical threshold of 95%, localized outbreaks could evolve into sustained epidemics. Meanwhile, norovirus has re-emerged in the headlines, disrupting not just the lives of cruise ship passengers but also pressuring public healthcare systems. Aboard the Viking Polaris, over 30 individuals suffered violent bouts of vomiting and diarrhea during what was supposed to be a tranquil voyage. While norovirus is notorious for its resilience, surviving on surfaces for days and resisting common disinfectants, its mode of spread highlights vulnerabilities in settings with dense human contact. Scotland's NHS Borders simultaneously battles its own norovirus outbreak, forcing restrictions on hospital visits and overloading healthcare staff. Experts draw historical comparisons with previous outbreaks, notably those that paralyzed hospital networks in the United Kingdom in the early 2000s. The core lesson remains unchanged: rigorous hygiene, early isolation, and rapid surface disinfection are indispensable in stemming the tide of this extraordinarily contagious virus. Turning our gaze to the broader and more ominous threat of H5N1 avian influenza, we find ourselves confronting a virus long feared for its pandemic potential. Since 2024, 70 cases of confirmed or probable human H5N1 infections have surfaced across the United States. These infections are primarily zoonotic in nature, stemming from close contact with infected livestock, particularly within commercial agriculture. In a concerning development, Mexico reported its first confirmed human case earlier this month, a child under the age of 10, who succumbed to severe respiratory complications. The virus's high mortality rate among confirmed cases, hovering near 50% globally, continues to alarm epidemiologists, who observe with apprehension any mutations that might enhance human-to-human transmission. Reflecting on the lessons of H1N1 in 2009 and the sporadic H5N1 cases of the early 2000s, vigilance in monitoring viral genomic changes remains paramount. The emphasis among experts is on robust biosecurity protocols at farms, rapid genomic sequencing, and international transparency in reporting potential clusters. In Africa, there is a rare note of optimism. Uganda has officially declared an end to its most recent Ebola outbreak. 14 cases were reported, including 4 deaths, but thanks to swift coordination between the Ministry of Health and international partners, transmission chains were broken before the virus could spread beyond regional boundaries. Ebola, often romanticized in media as a harbinger of dystopia, is in reality a virus that thrives on delayed detection and community mistrust. Uganda's success this time contrasts sharply with the devastating West African epidemic of 2014-2016, where delayed international response and fragile healthcare systems allowed over 11,000 deaths to occur. Analysts cite Uganda's improved surveillance infrastructure, community engagement strategies, and stockpiles of experimental vaccines as instrumental factors in this turnaround. Elsewhere, ongoing surveillance efforts track the silent movement of poliovirus, particularly vaccine-derived strains emerging in under-immunized populations. Instances reported in Africa, parts of the Middle East, and Southeast Asia serve as chilling reminders that even in diseases we consider relics of history, vigilance must not waver. Public health historians reflect on the near eradication of polio in the 1990s, a triumph precariously balanced on sustained global vaccination efforts. Today's outbreaks are not mere accidents. They are warnings that complacency, logistical challenges, and political instability can unwind even the most extraordinary public health achievements. Simultaneously, scientists are grappling with the slow, unnerving evolution of chronic viral threats. Hepatitis B and C continue to afflict hundreds of millions worldwide, quietly driving epidemics of liver cancer and failure. The search for an effective universal vaccine remains elusive, though mRNA-based candidates are showing early promise. Experts note parallels with the early days of HIV research, cautioning that breakthroughs, if they arrive, will require not just scientific innovation but also political will and equitable distribution frameworks. Another front line in the viral battle lies in the growing threat of zoonotic spillovers, where previously animal-restricted viruses find pathways into human populations. Researchers have spotlighted regions of intense deforestation, climate change-induced habitat shifts, and sprawling megacities as crucibles for future pandemics. Unlike purely random events, many emerging infections are now understood as predictable consequences of environmental disruption. The narrative has shifted, from merely reacting to viral outbreaks, to anticipating and mitigating the ecological and societal factors that make them inevitable. Amid these immediate concerns, the virology community is also observing peculiar patterns in long COVID, which remains an enigma even years after the acute phase of the SARS-CoV-2 pandemic. New studies suggest that latent viral reservoirs, persistent immune dysregulation, and microclot formation could explain the bewildering array of symptoms experienced by sufferers. This growing burden of chronic illness carries profound social and economic implications, particularly for healthcare systems already strained under the weight of aging populations and existing chronic diseases. Against this intricate tapestry of threats and victories, one truth emerges with crystalline clarity: viruses are not merely adversaries. They are indicators of how intimately our health is woven with our behavior, our environment, and the structures of our societies. From the corridors of hospitals to the remote corners of tropical forests, every decision humanity makes shapes the contours of viral evolution. As we close today's update, it is worth remembering that vigilance, preparedness, and a commitment to scientific inquiry are not merely options, they are necessities. In a world where the distance between a livestock market in a remote province and the heart of a metropolis is measured in hours, our collective resilience depends not just on medicine, but on foresight, cooperation, and humility before the complex systems we inhabit. Thank you for joining Infection Navigator. Stay curious, stay cautious, and above all, stay compassionate.